STARS is part of the Heart Rhythm Alliance group, the Arrhythmia Alliance. I established STARS initially and then went on 16 years ago to establish the Arrhythmia Alliance and the AF Association. And people say, why 3 organisations? But when patients are given a diagnosis, they Google that diagnosis. So it's important that they can identify with a group of like-minded people. STARS is international now. It started at my kitchen table in a little sleepy village in the Cotswolds, and we now have outreach in excess of 40 countries. Some countries just literally have the website, or other countries like the US, we now have 4 staff employed there. So anyone that can help us with translations or have colleagues in other countries that would like our information, please put them in touch with us. So why do we do what we do? Well, I'm not going to go through every one of these facts because I'm hoping that everybody that's here will know most of them. But just to emphasise that 30% of adults and 39% of children diagnosed with epilepsy are misdiagnosed, and many of them have an underlying, potentially fatal arrhythmia, and yet maybe their only symptom is syncope, blacking out, a seizure when it's not a seizure. So we need to engage with our neurological colleagues to make sure that these patients don't end up going down the route of neurology and epilepsy. A member of my staff was misdiagnosed for 28 years with epilepsy. After she contacted STARS and we were able to signpost her to a medical expert, she was correctly diagnosed. She was weaned off her anticonvulsant drugs and has gone on to lead a much more active life. Sadly, we still hear of people being misdiagnosed, not just for weeks or months, but years, even decades. So there is a major problem and we do need to be addressing this. And also the cost of syncope. Up to 6% of all hospital admissions are due to syncope, and most of them don't need to be admitted to hospital. But because they're not being diagnosed, they are given a barrage of tests, most of which are unnecessary. 10% of falls in the elderly are due to syncope, and Roseanne Kenny obviously will be telling you a lot more about that later today. 23% of the elderly in nursing homes experience syncope, and all too often they end up in nursing homes because they've had a fall, broken a hip, fractured an elbow, and can no longer be independent. And yet if syncope had been diagnosed in the first place and appropriately treated, they may not have had that fall. They may not need to be in a nursing home. So the impact on daily life for patients with syncope and their families is immense. And, on our website, we have a wealth of stories of misdiagnosis, long waiting times, lack of awareness, the psychological impact of blackouts. Every day we hear, and after 26 years you think you've heard it all, and still we're hearing of cases, young, old, any age. When I started this because of my daughter at 10 months old, I was told it was just a childhood thing. She turns 30 in August. Luckily, she seldom has attacks now, but it is not a childhood. It is not an elderly symptom. It happens to anyone of any age. And all that patients want, all any of us want when we're ill, is a diagnosis and treatment, information and understanding, advice and support, because all of that will lead to an improved quality of life. So the work of STARS bridges the gap between patients, healthcare professionals, governments and policymakers. Tomorrow we're in Westminster for our World Heart Rhythm Week event, where politicians will attend and hear about our work and the challenges, not only what patients face, but what healthcare professionals face as well, and how we need to improve the services. And we have NHS England, Public Health England, all attending, presenting and supporting our work, which is fantastic. And we promote accurate and rapid diagnosis, as well as offering information on syncope for all age groups. We helped, what was through the STARS Medical Advisory Committee, that the STARS TLOC guidelines in 2011 were published. NICE have just reviewed and decided that they don't need an update, despite us pushing, saying, the ESC have updated their guidelines. So we will keep on at that. We need to make sure that it doesn't get lost in the busy, nice agenda. We launched the Blackout Checklist, which is probably the singular most successful piece of work we've ever done. The checklist many years ago was launched by Sir Roger Moore, James Bond, who was our patron and a fantastic individual. It helps patients to prepare for an appointment. It helps clinicians, it prompts the clinicians to ask questions. Is there a history of unexplained death in the family under the age of 35? Because all too often, sadly, you hear of these sudden deaths only to find that the person used to faint, they used to pass out. That's just one example. We often have consultants asking us to give them a supply of the checklist, and when they write to the GPs after seeing a patient, they enclose a checklist and say, next time you refer a patient, please ask them to complete this, which is fantastic, and it also has won a British Medical Association award. We produce information on syncope, coping mechanisms, treatments, etc., all of which are downloadable from the website. Also, if you would like hard copies for in your clinics, just contact us and we can send you supplies. And again, for all ages. We also have an educational website and resources for school and children. All too often, children are stigmatised, they're bullied because they have that funny thing where they pass out. Teachers don't want to include them in sport, in outdoor activities, etc. So we have care plans, all of which helps to ensure the child is included and that everyone becomes aware that somebody fainting doesn't mean that they're excluded or they're different, but that they need to have better understanding and coping mechanisms. Importantly, when I was asked by my daughter's neurologist, who diagnosed her in Scotland, even though I lived in the Cotswolds, and it took over 3 years for a diagnosis, he asked if I would start a small patient group and maybe speak to 10 families a year. Well, that's probably running into well over 1 million now. And at the time I said I would, as long as he checked anything I did, because I'm not a doctor, I'm not a nurse, I didn't want to produce inaccurate, misleading information. From that, we've gone on to establish the STARS Medical Advisory Committee. And most of the speakers here today, Richard Sutton, Nick Gore, Bob Sheldon, Satish Raz, etc., are all members of our International Medical Advisory Committee. So anything we produce is reviewed by them and approved by them. So all our information for patients and healthcare professionals have been approved by an expert medical advisory committee. In the UK, it's endorsed by the Department of Health. In America, it's endorsed by the American College of Cardiology, and I believe we're the only non-profit that has that endorsement. So you can feel safe in the knowledge that the information we're sending you is accurate, up to date, and has been approved by the world experts. We also produce resources for healthcare professionals, and if there is something you're looking for and you can't find, please let us know, because we quickly turn it around if there's something missing and get our experts to review, write and approve. And we have the various care pathways which often we're asked for as well. So we provide advice and support through our helpline, our website, online forums, educational videos. We're just going into a partnership with a healthcare video company, and they will be videoing the presentations and interviewing throughout the day, which will then go online so we can reach more healthcare professionals worldwide, as well as, of course, social media, hashtags and everything else that you have to do with social media that I'm quickly learning about. And we have our awareness campaigns. I started by saying about World Heart Rhythm Week. This brought about change of policy in the UK with the extra chapter on the National Service Framework for Coronary Heart Disease, and the extra chapter, arrhythmias and sudden cardiac death, and it included the very, very first recommendation. Anyone presenting with unexplained loss of consciousness should receive a 12-lead ECG, which should be reviewed by a heart rhythm specialist. We did that from my kitchen table, engaging others to write to their MPs, for MPs to ask the health minister, and that's when I launched Arrhythmia Alliance. And I was asked to sit on the expert writing group as the first non-medical person. So it's amazing, with determination and commitment, what we can do to bring about change. We've gone on to bring about other changes, but we still need to improve syncope services. And as the people that know me, I am committed to do that, and that's why I'm so grateful for events like today. We are expecting approximately 150 people that will go back into their clinics and be more knowledgeable and hopefully improve those services, so that the hundreds of thousands, if not millions of people that suffer with unexplained loss of consciousness will get a diagnosis and learn how to better manage their condition. There are lots of impactful stories, many of which can be found on the website. I won't go through all of these, but it is lovely to get feedback when we know that we've made a difference to an individual, to a family. And it's thanks to all of you and your services that this is happening more and more often now. Because with education, support, and accurate treatment, it all leads to an improved quality of life. And it's a bit boring for those who've already heard it, but I always say none of us choose to be a patient. If we wake up in the morning with a headache, feeling unwell, we want to get better. We don't want to be ill. And so the sooner we can get a correct diagnosis, appropriate treatment or management, the sooner we can ensure the patient is returned to a person leading an active and as normal life as possible. So as I say, I hope after today, many more patients will go on to receive the correct diagnosis. Sometimes a diagnosis is all that's needed to bring reassurance. For others, they do need treatment, and obviously you'll be hearing about all of that today. Following on from this meeting, there's also the Heart Rhythm Congress that we organise at the ICC in Birmingham every year in October, which I hope many of you will attend. There are symposiums on syncope, on AF, on all arrhythmias. Patients come on the Sunday. Last year we had 525 patients attending, and then Monday through Wednesday it's clinical symposia. So please have a look at the heartrhythmcongress.org website, and I hope to see many of you there in October. Thank you.